Hi, everyone. I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. Today, I would like to explain to you how I see the severity of dysphoria in a sense of how do I assess whether dysphoria is severe and whether it is very mild. Recently, I did a short video about the severity of dysphoria, and a lot of people have asked me, well, how can you tell? What are the telling signs when dysphoria is really severe? And what are the telling signs when dysphoria is very mild? It's a very valid question to ask because I often say that surgical, especially surgical interventions are for adults, are a good way to go when dysphoria is severe, especially in severe to your body, in severe into relationship to your physicality. I always say that if you have very mild dysphoria, there's something to explore there because especially if you don't have any physical dysphoria, but just have social dysphoria and some mild social dysphoria, there is something to explore there instead of jumping into surgical and medical intervention, again, for adults. This is just my clinical opinion because I have seen if people feel very neutral about their body and don't have any physical dysphoria, I have seen people where there was just really no need to go through surgical route. So how do I gauge dysphoria and what does it really mean, the severity of dysphoria? All of you watching know what dysphoria feels like. Dysphoria is distress, it's discomfort that you feel in relationship to your gender assigned at birth and in relationship to your gender identity. It is the discrepancy that exists between, if there were the two bookends, if you will, your gender assigned at birth, and then over here, what we're seeing over here is going to be your true authentic gender. What's in between, the wider the gap, the bigger discrepancies, the bigger the distress, I should say, you're going to feel. The closer it is to gender assigned at birth, the lesser of distress you may potentially feel. So dysphoria is really, it's a distress and a severe discomfort that tends to arise out of this gap between the gender you were assigned at birth and your actually authentic gender identity. And everybody is going to have dysphoria at different degrees of frequency, meaning the dysphoria sometimes for some of you is something that's happening daily. For some of you, the dysphoria is something that is maybe doesn't necessarily happening daily. Maybe there's some days when dysphoria really affects you. For others of you, the dysphoria is going to be something that maybe has a more infrequent frequency to it. The duration, how long it's going to last, is also going to vary for all of you. For some of you, the duration is ongoing, constantly there. For some of you, the dysphoria is the duration only lasts as long as the days or hours when it really hits you. So duration, frequency also going to vary. Dysphoria, as I always say, is a fucking beast. Sorry, no other way to say it, but it is. It's a monster. It's a beast. And it doesn't give a shit about you. It doesn't give a shit about how you feel. It doesn't give a shit where you're at in your life. It doesn't give a shit about what you plan to do about it. And it tends to strike up. Another word I use for it is silent assassin. It tends to strike up at different times. That's because it doesn't have any regards at all for what you have planned. It doesn't care what you have planned for today. It doesn't care if you're sitting at an important board meeting. It doesn't care if you're out spending time with your kids. It doesn't matter if you're intimate with your partner. It will strike whenever it strikes. And dysphoria will operate on its own way, and who knows why sometimes it occurs, and I can only hypothesize and often do, but sometimes it's just simply something that comes up because it is there. It's like a nagging migraine. People who have chronic migraines, who knows when sometimes you get migraines, sometimes you can eat the best foods, sometimes you can do everything to prevent migraines, and yet they still happen. Dysphoria is kind of a similar way. So dysphoria, like I said, it has its own agenda. It has its own plan that's separate from yours, unfortunately. And as a result, it is very common for you to listen to me right now and to say, my dysphoria is very mild. And then a week later or months later, to suddenly realize that your dysphoria shifted from mild to severe. So again, when people even ask, well, how do you tell when it's severe or when it's mild? The reality is that it can really shift on you. It can really go from mild to severe, from severe to mild to intermediate. It can get all over the place. Again, because we're dealing with something that is very subjective to you, to your relationship to your gender, to how big that gap is, to how old you are, to what your circumstances are, to where you live, to how conscious you are about your dysphoria. All of those things go in. Oh my God, all of those things are going to be important in terms of assessing when and how dysphoria is going to strike and how severe or mild it is going to be. What I can tell you is this. In my opinion, severe dysphoria is a dysphoria and individual experiences where it is severe to the point where that individual is unable to really go throughout their day. Think about other things that may be very severe. Depression, for example, can also range from severe to mild. Mild depression is you feel depressed, but you still wake up and you still go on with your activity. Severe depression, you can't even get out of bed. Very severe dysphoria is very debilitating to the point where you literally can't get out of bed. And those of you who ever suffered, unfortunately, severe dysphoria, you know what I'm talking about. You can't even step outside into the world. You can't even look at yourself in a mirror, period. You just absolutely cannot look at yourself. That's how severe dysphoria can get. The other level of severity of dysphoria is that you do have stamina and grit to push yourself out of the bed and go to work, but you're constantly thinking about dysphoria. In my opinion, if you're constantly in a state of dysphoria, it's always there. Even if it's not there every single second, but if it's there, I would say 70% of your day, to me, that's severe. That's a severe sign of dysphoria. A less severe form of dysphoria is when it's there, but you're able to still cope with it. So whatever coping you have in relationship to dysphoria, whether it is throwing yourself into work or avoiding it, binge watching something, overeating is a common one, drinking is a common one, whatever your coping is in regards to dysphoria. A milder form of dysphoria is when you can still employ your coping strategies. If you're employing your coping strategies and they're able to at least minimize the experience and the severity of dysphoria, that's fortunately still good. It's really difficult when you are trying to employ those coping strategies and you absolutely cannot quiet down the dysphoria. Unfortunately, that's when it gets really, really tough for people. And that's when people are really struggle and really, really suffer when they just done everything and it's still there, and because it's so painful and it's so hard. A lot of other folks they never even experience very severe dysphoria, but have a milder form of dysphoria. What is a milder form of dysphoria? It means you still have dysphoria, no doubt about it. By the way, the severity of dysphoria does not in any way negate your transgender identity. It doesn't necessarily mean that, oh, because you have less of severity of dysphoria, you're less of transgender identified person. No, not at all. It's just really level of pain. Just like with migraines, just because somebody has severe migraines and somebody has on and off migraines, it doesn't negate the fact that the person is still struggling with migraines. So I just want to make that clear. A milder dysphoria is when you have dysphoria and you feel it and it's uncomfortable and even can give you pain. You're able to cope with it. Again, think about coping as putting a Band-Aid on it. You're really not curing it. You're really not taking care of dysphoria, but you're just really minimizing that pain that it brings you, the distress that it brings you. You're really quieting it down. So you're able to cope with it to some extent. On top of that, your dysphoria is maybe not as frequent in duration. And maybe it doesn't also happen as often and not for a very long persistent time. You're able to get dressed, to go to work, but you're struggling with dysphoria. There's no questions about it. So there's all these different types of consideration to take a play when I assess level of dysphoria. A lot of adults, more mature adults who come and try to work with me, their dysphoria ranges from very, very severe. That's usually when people reach out to a professional, when it's so severe. Unfortunately, we really need to learn how to reach out to professionals before it gets severe, but I totally get it. So a lot of people, adults who reach out to me, are at a state where they're like, help, I gotta do something about this. Or adults who have a mild dysphoria, where they say, you know what, I've been living with this all of my life, I can still cope with it, but I'm getting older, and I'm starting to ask myself those existential questions. Why should I continue to cope with it? Maybe it's time for me to just really live for myself and really embrace who I am. So when I work with adults, I look for all of those variables in your life. I look at what's your coping methods, how do you feel on a daily basis, how often it strikes. Again, as I did in one of the videos, there's the difference between physical and social dysphoria as well. So to what extent do you have social dysphoria? To what extent do you have physical dysphoria? To what extent do you have particular physical dysphoria to particular body part? Sometimes people have, I've had clients who had physical dysphoria to such severity in regards to just their face, how they look, how they see themselves, that they have avoided mirrors all of their lives. They have literally seldom, if ever, looked at themselves in a mirror. That's severe. That's an example of severe dysphoria. You can't even look at yourself. That's really hard. That's really, really tough. So comment below, let me know, what's your understanding of dysphoria? Sometimes I think it's very hard for people to gauge where's they at. But again, when I say very severe, I mean very severe. We're talking about pain. We're talking about suffering. We're talking about really hard way to manage it. And when people talk about mild, that means that they're able to at least deal with it on some basis. Again, severity or lack of severity does not negate that the person is still struggling with dysphoria. Dysphoria is dysphoria. And also, let's not forget, people who have severe dysphoria today may, hopefully, I really hope, may tomorrow, maybe their dysphoria can get down to milder form. But it is much more common for people who have milder dysphoria to suddenly experience a more severe dysphoria, because as one becomes more aware of their distress, of their gender, also become more aware of what they want to do about it. Those are all factors that tend to play into potentially increasing the dysphoria. So comment below, let me know what's your understanding of the severity of dysphoria, what you have experienced yourself personally. When you say you experience severe dysphoria, what does that feel like to you? And when you say you experience mild dysphoria, what does that mean for you? What do you mean by that? What does it mean mild? How do you classify mine? I don't think there's one consensus along clinical psychological community on defining severity. I think we all define severity in terms of coping. The less you're able to cope with something, the more severe something is out to be. That's kind of like a pretty standard, if you will, way of looking at it, or pretty simplistic, I guess, not standard, simplistic way of looking at it. Like I said, just like with depression, if you just absolutely cannot even cope with it, well, that's pretty darn severe. I mean, people who are severely depressed can't even get out of bed. That's how difficult it is. So same thing applies to dysphoria, at least from my professional viewpoint. Comment below, let me know. Love reading all of your comments, and I will see you all next time. Bye.